So, we're here to talk about Medicare. And one of the things that most people who are either Medicare recipients or have parents who are recipients of Medicare benefits don't realize that Medicare is probably the one area in this country that ends up being the victim of scamming more than any other area. And one of the things we talk about when we look at fraud is we talk about the issue of following the money, because these criminals are very capable. They know what is happening in our society, and as a result, they look at where the money is, and that's where they target things. So, for example, Medicare, major target for scammers. Senior citizens who may have lost a family member, a significant other, they probably have some kind of savings or something put aside for their retirement, and that makes them a target. People between 25 and 45 are probably the most vulnerable. They fall victim to scams more frequently than any other age group. And we don't think of that, but again, follow the money. Well, they don't have a lot of money, but there are a lot of them, and sometimes that makes them very attractive, and also they're more likely to fall victim to the criminals. So we're going to look at Medicare scams, and I call this, it's enough to make you sick, and I think, we'll see why that's true. So who commits the fraud? Who are the people that we need to know are involved in this? And there may be some surprises to this. Yeah. Well, obviously they're criminals. There are a lot of criminals who target seniors, doctors. It doesn't take too much for a doctor to realize that by using specific codes on a medical treatment, payment will vary. And some unscrupulous doctors will end up using different coding as their way of trying to make some extra money. Pharmacists. I don't know what's going to happen with the changes in pharmaceutical laws recently, but pharmacists, because of the cost of medications, clearly that's another area where if you're following the money happens. And then finally, us. Seniors are responsible for committing fraud against Medicare in a variety of different ways. Accepting treatments or durable medical equipment that they don't really need. Seeing an opportunity to collect something, feeling, well, I'm owed that by society, and it may not be something that you are owed. So those are the players here. It has gotten worse over the last several years. Just to give you a sense of some of the data on this, and I usually don't dwell on data, but the Federal Trade Commission reported that in 2020 there were over 10,000 complaints made to the Federal Trade Commission. That doesn't include, by the way, the FBI. It doesn't include what complaints are lodged to Medicare itself, but 10,000. So when you look at how many claims there are, that's the tip of the iceberg, and it's one federal agency. In 2020, this amounted to approximately $130 billion. Not million, billion. So we're looking at sheer growth, and we know that the numbers when they're finally churned out for last year, and this year will be significantly higher. There's been a growth in the losses to Americans, not just through the government, but because they've ended up spending money that they didn't need to. And in some cases, they were lured by criminals into making a purchase with the promise that Medicare will cover it. And then they find out Medicare does not cover it. And I'll give you one very quick example. A lot of people, in order to determine whether or not they are likely to contract a particular disease, will have genetic testing done. It's very expensive.
Yeah.
And only in a few cases will Medicare cover it. So that's one example of how individuals end up losing money. Scam reports are generally not duplicated. So when we're looking at the number of reports, we actually have to add what's reported to each of the agencies, meaning the FBI, Federal Trade Commission, Medicare, the Attorney General's offices in all the states. As a result, we're estimating something in the nature of 100,000 criminal reports. And that's why you need to kind of add all these things together in order to get a big picture. So what's the motivation? What brings Medicare to a point of being attractive to criminals and to people who are trying to scam the system? Well, one thing is authority and credibility. And I popped on a little picture of some folks wearing white coats. We have somebody wearing a white coat standing in front of us on the TV or anywhere else. We tend to listen to that because we respect authority in general and particular types of authority. So a doctor or somebody with a stethoscope around their neck, whether they're a doctor or not, that becomes very attractive to us. Scarcity, particularly during the COVID 2 years, when medical care was scarce, when hospitals did not provide for people to walk in and have something taken care of, it led to scams. People seeing offers to get treatment without having to wait in line. It was a scarce item. That made it attractive to criminals. Finances. It's big dollars. We don't have to go any further than that. Benefits. The fact that you, as a Medicare subscriber, are looking at benefits. What is in this for me? What will Medicare cover? What do I have to get separate insurance for? So you're looking at the perceived benefits. And I'll just give you a very quick example. There have been, all seems unstoppable advertisements on television for Medicare Advantage programs. And they're usually pitched by somebody who is a personality from either sports or TV. And as a result, we look at that and we say, oh, gee, I can get my transportation to the doctor's office covered. I can get my dental covered, my vision covered, my hearing aid covered. And it's all free, right? No, it's not. So, perceived benefits. Another thing is expediency. We don't want to wait. If you have a medical problem, you don't want to wait 2 weeks or a month or longer to get treatment for whatever it is that you need to have treatment for. So when somebody comes to you by way of the internet, by way of a phone call, and promises you that you can be treated for medical issues and illnesses immediately, suddenly you become very interested. And then finally, fear. Medical treatment is something that generates fear. The C word, cancer. And as a result, many people will try to find whatever cure they can get in order to, excuse me, in order to push that fear aside. And during COVID, we saw a lot of people falling victim to scams involving COVID cures or pills that would reduce conditions and problems. So what's subject to Medicare fraud? Well, medical care itself, telemedicine, home health care, hospice care, diagnostic testing, prescription drugs, you name it in the medical field, and it's going to be covered by one of those things. So let's look in depth at some of them. Medical care. By the way, some of the fraud is not intentional. For example, you go to a doctor's office, you have a particular kind of treatment done. Every treatment that is handled in the medical world has a code. Somebody has to enter the code on a computer, somebody makes a mistake. Doesn't necessarily mean they purposely made a mistake. But that mistake can end up costing Medicare and costing the patient. Diagnostic concerns. The idea that you want to know what is the problem that has to be dealt with and how can it be helped. And then medical transportation. If you can't be served locally and you have to travel to a major regional hospital, that becomes another area of scamming. Other services, well, telemedicine. Examples of fraud, misrepresenting the credentials. Somebody goes online and offers you treatment or offers you help and claims to be a doctor, claims to be a professional in medical care and is not. That's misrepresentation. That can cause not just financial issues, but also health issues for the person turning to the fraudulent advice. Medical identity theft. Medical identity theft happens regularly. 2 examples in Vermont. The Rutland Regional Medical Center had its entire patient database hacked or stolen about 3 years ago. That included all the information that the hospital had for 10 years. So every patient was notified, this is what happened. There's not much you can do about it now. So the result is people had their identity stolen. Another local hospital, the University of Vermont Medical Center, same thing happened there. So it's not unheard of. We like to think that our records at a hospital are kept safe. In reality, anybody who has the skill can break into a computer file. You get billed for medical services that were telemedicine that you never received. And finally, the possibility that you may be approved for unnecessary testing. So with all of that, telemedicine can be very dangerous. It also is very good because it saves a lot of people from having to travel to a doctor's office, spend time trying to get an appointment. It is a more efficient way to deal with things that don't need a doctor's presence. Some other things about it, be wary of unsolicited offers. If you get a phone call that says, you're eligible for, and we haven't seen a lot of it lately, but a few years ago, you're eligible for a back brace, you're eligible for a knee brace, and Medicare will pay for it. Or you're eligible for a mobile wheelchair. Those are the types of services or products that end up with people, first of all, not getting what they think they're getting, and secondly, being billed for something because Medicare doesn't approve the item. Best example, the motorized wheelchair. people found themselves billed for several $1,000s because Medicare didn't approve it and it never was given pre-authorization. And then, some of the things to be looking for, pain creams, orthotics or braces, as I just said, genetic testing, other unrelated services. So there's a number of things that come out. And one of the sad parts is seniors tend to try to stop aging. I know I do. So, if we're in that mode and we see products on television that will benefit us either cosmetically or help our mental capacity, a lot of seniors will fall for those things and try to prolong life and prolong their mental capabilities. Other services, home health care. One of the major areas where we see scams, typically by people who are not registered to provide health care. But somebody finds out that there's a person who will come into your house, do your cleaning, help you get through the day, and then that person slowly worms his or her way into the victim's heart, and as a result, the victim becomes a victim of scams. When you're looking at home health care services, there are some things to identify. First of all, take a look at whether that company is actually licensed to do what they're trying to do. In the state of Vermont, it's necessary for any agency that does home health care to register with the state of Vermont. And the business has to be registered with the Secretary of State's office. There are standards that are put in place by the State Department of Health. So you need to make sure the company and the services that it provides are registered with the state. And it's very easy to check those things out. And then the people who are actually providing the service, are they licensed? Do they have the credentials? Do they have the education necessary? So there are a number of things to be watchful. Hospice care, we're seeing a lot of unscrupulous providers when it comes to hospice. We're seeing people coming into a home to provide end-of-life services who really don't know what they're doing. Luckily in Vermont, we're not seeing a lot of it, but if you lived in Arizona, if you lived in Florida, you would find this happening constantly. So, hospice care, the idea that you need to be aware of who's providing the service and that they are appropriately prepared to do that. Examples of the fraud, false certification. Billing at a rate that is higher than what the standard rate would be. And this is where people simply don't take the time to check. And most importantly, it may need to be the children of the senior who does the checking. And so they need to be read into this too. And billing for services that you don't get. And then we see a lot of hospice situations where there is a monetary kickback that goes to the provider. Testing. I just gave a few examples. We see the telemarketers doing this all the time. Emails, text messages, and the whole purpose here is to convince somebody that they need to be tested and that their doctor may not be providing those tests to them, so somebody else needs to. And the attempt here is to convince the potential victim that he or she really needs the testing to be done. Prescription drugs, I'm not going to spend much time on this one because we all know that the prescription drug issue has gotten to a point of multi-billion dollars, and the idea of people being sold things that are not really effective or even legal. As I say here, you know, the idea of getting the COVID-19 test kits. They used to be free, not anymore. And some of the test kits cost as much as $100. So, watching what happens with prescription drugs, watching how pharmacies are doing is important. Again, this is a regulated area of medicine. Pharmacists have to be licensed by the state. There are specific laws over how they have to perform their duties. So it's, in terms of a traditional pharmacy, very well regulated. In terms of the pharmacy that you look at online, it may not be. So here's where the scam is. It's on the internet. It's in social media. Text messages, phone calls, in person, mail and print. Now, we're seeing less of mail and print scams and less in person, and it's for one reason. Those things cost money. You have to pay somebody to do the in-person visit. You also have to pay for mailing and printing. So those tend to be less in favor. Texts and phone calls, internet, social media, it's all free. So doing the scam and targeting Medicare recipients is very easy. On the internet, emails, scam websites, social media, things popping up on Facebook and some of the other social media like Twitter, promising medical miracles almost, and yet not delivering. Did I just hit that? Yeah. In social media, necessary to be cautious about what's being posted, things about symptoms, medical conditions. Quite often it's not something that's targeting an individual. So we have a real problem in this country, and I happen to be one of the victims of it. I'm a diabetic, and about 40% of the American population is diabetic, another 10 to 15% pre-diabetic.
I'm pre-diabetic.
So that puts us in this special category for being targeted. Other, medical conditions that tend to be widespread in this country: heart disease, obesity, cancer may not be as widespread, but the word scares people, and that makes it more believable when it shows up in social media. So you need to be cautious when looking at what's popping onto your screen. And we always recommend that when you feel that there's something that you need to do, you see something in social media, oh, I better check that out. First place to go, your regular physician. Text messaging, telephone calls, robocalls, they're illegal, but because these are being done by criminals, they don't worry about an illegal phone call. They're simply worried about getting caught, and the robocalls happen constantly. It's kind of interesting because I have my cell phone set up to block phone calls. And once in a while, I'll unblock them and see what I get. If I unblock for about a day, I will get about 20 to 30 calls. So, it's happening. Telemarketers are offering fraudulent treatments, fraudulent testing, fraudulent cures, fraudulent vaccines. All of these things are being peddled to the American consumer, and in particular to the Medicare recipient. So if you're being targeted, if you get that phone call offering you something that's of a medical nature, it is a scam. Your doctor is not going to approach you that way. Medicare will never call you. Social Security will never call you. If there's an issue, they will send you a letter. But when you get that call and somebody says, I'm Margaret with the Social Security Administration, people listen and then they fall victim. In terms of print, it could be letters, flyers, posters, newspaper articles, magazine articles. So, again, we need to be really aware of what is happening to target us, and then in person, somebody going door to door. Medical suppliers do not go door to door. And the reality of this type of scam is that people fall for it because they believe the person coming to them cares about them. So now the person setting up a relationship, they may not even try to sell something at that point. The effort may be, I'll tell you what, I can come back with more information. So how do you get out of the trap? Well, as I said, Medicare's not going to call you, text you, email you, unless you put in an inquiry and they're responding. But they don't do that as a first step contact. If you originate the contact and you know that you're connected with somebody, and I'll use Social Security or Medicare, then you can be certain that that person is legitimate if you've followed the information and made sure that you're using a valid number. A lot of people get kind of concerned when they try to contact Social Security and the first thing the operator is going to ask for is your Social Security number. But again, you've made the initial contact. You're not talking to somebody who called you. It's illegal, and this is something most people don't know, but it's illegal for a medical provider or an insurance provider to contact you directly unless you have a relationship with them. Now, what does that mean as far as relationship? Let's say you see an advertisement on TV, and the ad is for a Medicare Advantage plan. And you say, boy, that sounds really good. I'm going to call them. You make the call, you've established a relationship. So it's as simple as making that call. When it comes to, for instance, in the case of Medicare Advantage plans, our recommendation is don't contact one of these companies based on an endorsement from a famous person. Contact the state health department. In the state of Vermont, you can contact the Vermont Department of Health, or you can even contact Medicare. And if you go to the Medicare website, it posts all of the appropriate Medicare Advantage plans that are available to Vermonters. And then you can check them out independently without having to contact them. So you save yourself from creating that existing relationship. Providers cannot email you by law unless you have some kind of agreement and saying that, you know, it is okay for you to receive email. Now, quite often when you go online and you're going to one of these online providers, somewhere in the long list of things that are flashing on the screen, it says you're providing permission for us to send you information. They can't come to your home unless you've invited them. And they can't even leave information tied to your doorknob. All those things are illegal, and it's all set to protect seniors from being victimized in Medicare scams. So what do you need to do? Well, one thing you need to do is verify your expenses. At least for a period of probably no more than 1 year, any records that you receive, Medicare statements, doctor's bills, hospital bills, private insurance statements, they should be kept, and you should verify by checking all three of those things, and we'll get into the specifics of that. Keep copies of bills, and make sure that whatever you are being billed for is something that you actually received. Now, it might take a little bit of detective work, because probably your hospital bill will have a bunch of code numbers on it. And you need to be aggressive and say to the hospital, I need an explanation of what these codes are. And the same thing's true with doctors' offices. You need to compare, you know, if you have Medicare and you have supplemental insurance of some form, or Medicare Advantage plan, you need to make sure that what's on the bill and what's on the statement from the insurance company or Medicare match. And then don't be afraid to ask questions. One of the biggest problems Americans have is they tend to be very good at listening, but when it comes to something like this, they don't ask the questions that are necessary. So asking questions. 3 critical documents: your provider bill, your Medicare summary notice, and then the EOB, or the explanation of benefits, that comes from your insurance company. Go on. On the provider bill, verify the specifics. Make sure that what's there is what actually happened for you. Make sure the date of service is right. And don't hesitate to contact the provider. When you get your Medicare statement, the MSN, check those things and make sure that the items there match the items of your provider. And again, you may have to identify the codes. This is, you know, portable gaseous O2 and then a rental. Or some other codes like Professional Healing Solutions 555 555 1234. You want to make sure that if that's the provider for you, that that's what you expect as a bill, and that they billed Medicare what you saw as what your bill would be. And then you want to make sure that that and the provider bill match. Okay? And if you see any problems, notify Medicare. And then the third thing is your private insurance provider. And typically it looks like this display. And it takes a little while to figure out the whole thing, but it's going to tell you how much you have to pay out of pocket. It'll tell you how much your insurance company is paying, and quite often there's something else that says other payments, and the other payments in this case would be Medicare. So now you have three documents. You have a provider bill, you have a Medicare statement, and you have a private insurance statement. Once all of those things match, you can get rid of them. You don't have to keep them forever. And the reason why is all three of those are available online. Your provider can give you a copy of your bill. Medicare, you can go into your Medicare account and see all of the items that are on the Medicare statement. And your private insurance company also does that. So once you've cleared the information and made sure that what you're being billed for is what you received, and everything is fine, you can get rid of that paper. How do you get rid of it? Shred it. Shred it. Don't put it in recycle. The information that's on it is very personal. It may not have an account number, but it will have what you're being treated for. It will have the approximate expenses that were involved, and it will end up telling somebody, gee, we can commit fraud against this person by focusing on their medical situation. So you want to shred the documents once you've done the verification. This is all available on one of the handouts, but if you see that there are discrepancies, there are places to call, there are organizations to get hold of, and if you've actually lost money, you need to report it to your local police department, file a criminal report. That gives you a basis for the other agencies like the FBI, the Federal Trade Commission, and the Attorney General's office to go further on the specifics of your issue. So, police report, if you avoided being scammed, you don't have to report it.
Thank you.
You can report it to other groups like AARP, which track them and then put out alerts saying beware of.
That's what I did.
Yeah. But it's not something that you can report to law enforcement. But all this information is on the information sheet that's on the table, and I can provide it to people if they aren't here. So we can do that. We have gone through a lot of the scams and areas of danger in Medicare. And it's important for everyone, whether you are a Medicare recipient, whether you are about to receive Medicare coverage, or you have a close family member who's a Medicare recipient, benefit recipient, it's necessary to keep your guard up, to be vigilant, and most of all, when there's a problem and you kind of think there's an issue, ask questions. Don't allow this sort of thing to go on. We're dealing with a crime that takes easily $500 billion out of our economy. And between what people individually lose and what our government ends up losing, which hurts everybody, we need to be more vigilant and we need to be more prepared. If you have any questions, please give me a call. Actually, email me, egreenblood@aarp.org, and I usually answer emails. So, fact, 90% of the time. So, thank you for being with me today.